She then presses gently on the tragus, the portion of cartilage that projects just in front of the external meatus of the ear canal. This action helps the medication flow into the ear canal. After the client remains in the side-lying position for at least 5 minutes, the nurse inserts a small piece of cotton fluff loosely just inside the meatus, not pressed into the canal, to be left in place for about 15 to 20 minutes. Following an otic installation, discard your gloves, wash your hands, and document the procedure. Also evaluate and record how the client tolerated the procedure, as well as the client's response to the medication, including therapeutic as well as adverse effects. Nasal installation of medications is a form of topical administration, a route used most often for rapid absorption of certain medications, either for their local or systemic effects. Drug uptake by the intranasal route is especially fast because the upper portion of the nasal passages is lined with mucous membranes that are richly supplied by a network of tiny blood vessels. Medications given by the nasal route include decongestants to reduce nasal and sinus congestion, saline solutions to loosen secretions and help clear nasal passages, antiseptics to treat local conditions, corticosteroids to reduce inflammation from nasal polyps or allergic conditions, anesthetic agents to ease the discomfort of transnasal examinations and treatments, a mast cell stabilizer to treat asthma, and a nasal mist influenza vaccine. Nasal sprays are often self-administered, as it is easier for the client to control the timing of inhalation, which should be done as the spray enters the nasal passages. When a client is using these preparations, it is important to assess the nasal passages for signs of irritation and to evaluate the client's ability to administer the nasal spray effectively. When you are preparing to administer nasal drops to a client, follow the same initial steps as you would for any medication administration. Screen the client for allergies to the medication, explain the procedure along with what to expect during administration, the desired effects, and the possible adverse effects of the drug. Make sure you are administering the prescribed amount and strength of the drug to the right client by the right route at the right time. Cross-check the medication container with a medication order and check the drug's expiration date. Medical asepsis, or clean technique, is appropriate for this procedure since the nasal cavity is not considered a sterile area. Gloves are optional but recommended when the client has a nasal discharge. Nevertheless, it is still important to prevent contamination of the medication container and equipment. Avoid touching the nasal mucosa with the tip of the medication dropper or bottle. If the dropper is contaminated, placing it back in the container will contaminate the remaining solution. Before administering nasal drops or sprays, assess the client. Are the client's nares irritated? Are the nasal passages congested? Does the client have a nasal discharge, polyps, pain over the eyes, fever, anorexia, or cough? Document your findings and contact the provider if necessary. Next, plan how you will position the client for the nasal installation. Supine positioning is best. You'll want to be sure the medication will reach the mucous membranes in the upper portion of the nares, both for maximum absorption and to keep the solution from flowing back out of the nares. The optimal head position will vary with the purpose of the medication. For most nasal installations, tilting the head backward and aiming the dropper toward the client's eye will direct the solution toward the posterior pharynx. To treat the ethmoid and sphenoid sinuses, hyperextend the client's head by having her tilt her head over the edge of the bed while you support her head with one hand to prevent neck strain. To treat the maxillary and frontal sinuses, have the client hyperextend her neck and turn her head slightly toward the side to be treated. Again, support her head with your hand. If the client cannot tolerate tilting her head over the bed, place a pillow under her shoulder to tilt her head backward. When you are preparing to administer nasal preparations to a child or to a confused client, be sure to have a family member or an assistant on hand to keep the client in position during the installation. This procedure can easily frighten small children and confused clients, so be especially gentle and reassuring as you administer the medication. Now let's go ahead and demonstrate a nasal installation of a decongestant prescribed to relieve uncomplicated nasal congestion. We'll assume the nurse has verified the client's identity, screen the client for allergies, and explain the procedure and its effects. She has also checked the medication record for the appropriate drug, dosage, strength, route, and time, and has checked the container's expiration date. She then assembles her equipment. She will need the medication container, facial tissues, gloves, and a pillow if needed for positioning. The nurse instructs the client to clear or blow her nose gently, unless contraindicated, to remove any mucus or secretions that could interfere with the distribution and absorption of the medication. Meanwhile, she washes her hands and puts on clean gloves. The nurse then helps the client into a supine position with her head tilted backward. She supports her head with her non-dominant hand and instructs the client to breathe through her mouth. With her dominant hand, she holds the dropper 1/2 inch, that's a little over 1 centimeter, above the appropriate nostril, and instills the prescribed number of drops. She instructs the client to remain supine for at least 5 minutes and offers her a facial tissue to blot any seepage. Finally, she cautions her to avoid blowing her nose for at least several minutes. Following a nasal installation, discard your gloves, wash your hands, and document the procedure. Also evaluate and record how the client tolerated the procedure as well as the client's response to the medication, including therapeutic as well as adverse effects. When teaching clients to administer nasal drops to themselves or others, remind them to wash their hands thoroughly before and after the procedure. Then instruct them to assume a supine or sitting position with the head tilted back. Insert the tip of the dropper just inside the nares without touching the nasal mucosa. Squeeze the dropper or bottle to release the appropriate number of drops. Keep the head tilted back for at least 1 minute. Avoid blowing the nose for several minutes after instilling the drops. Check the nares regularly for irritation or inflammation and report any problems to the provider. Injecting medication by the intramuscular route deposits the drug deep into the muscle tissue beneath the dermal and subcutaneous layers. It allows rapid absorption of relatively large volumes of medication, up to 4 milliliters, into appropriate, well-developed large muscle sites, such as the gluteus maximus. In most cases, however, you'll give no more than 3 milliliters in a single injection. The blood supply to large muscles is greater than that to subcutaneous tissues. Thus, the systemic actions of a medication given intramuscularly take effect quicker. Muscle tissue also has fewer sensory nerves. Thus, compared with other parenteral routes, irritating and viscous drugs are better tolerated when delivered into a muscle. Various types of medications are delivered by this route, especially to clients who cannot take medications orally or when a drug's therapeutic effect would be altered by the digestive process. Despite its advantages, giving a medication intramuscularly is more complex and risky than giving subcutaneous or intradermal injections. To administer intramuscular or IM injections safely, you'll need a familiarity with the various needles and syringes used for IM injections, the appropriate IM injection sites, and safe injection techniques. You must also know how to use the safety engineered features of the needles and syringes you'll use to prevent accidental needle sticks and to ensure proper disposal of used equipment. General use needles and syringes are available in a wide variety of sizes. Typically, you'll use a 22 gauge, 1.5 inch needle and a 3 milliliter syringe for most IM injections for adult patients. However, you might choose a 2-inch needle for an obese client, or a 1-inch needle for an emaciated or thin client, or for an older client who has less subcutaneous fat and more muscle wasting. As a general rule, you would not give IM injections